One.
Welcome, everyone, and once again to the SleepTech Talk podcast, the podcast for sleep techs. And with your hosts, Emerson Kerr, Robert Miller, and me, Jerry Moneycarode. And we can't thank you enough for all the support that you've provided us all these past few episodes. But before we move forward and talk about what's happening today, I'm going to ask Emerson, our co-host, to tell you about our special guest. Emerson, take it away.
All right. Thanks so much, Jerry. We are so happy and honored to have one of our dear friends, Marietta Bibbs, from the wonderful state of Florida, right around the Clearwater-St. Pete area, to be with us today. We've all loved and known Marietta for quite some time. She and Willie are a fantastic pair, and we certainly have been blessed by them, and especially her role in sleep medicine. But we're part of what we want to talk about today is her vision of where sleep technology has been and is. But before we take a deep dive into that, I want to just pitch it back to Robert for a minute to tell us a little bit about today and what we can expect from our conversation with Marietta.
Absolutely. Thank you. Thanks, Emerson. Marietta said we couldn't talk about age, but we can use words like legend and pioneer and all of those kind of things to talk about her place in the industry. Again, we respect Marietta so much and wanted to make her our first guest here on the podcast. But really where we want to focus today, and it's really based on some information that she's sharing in different conferences that she is participating in. But it's related to changes in healthcare, how those changes have impacted the roles of a sleep technologist, and then what the future of sleep technology will look like, and the role of a sleep technologist in this future state. So, Marietta, thank you for joining us, and we'll let you jump in. Feel free to share a little bit about yourself, or even maybe even talk about some upcoming events that you'll be speaking at, so that people can make sure that they catch you in live and in person.
Okay. Well, thank you all for having me here today. It's really an honor to be the first guest, I suppose. I've been in sleep for a long, long time. Started out at Baylor College of Medicine in Houston and worked in the VA hospital there for many years. And I was a veteran, so it was very easy for me to work in the VA. I just always had this warm spot in my heart for veterans. So being a part of the VA was really important to me. And I was there for a long, long time, and then moved to Florida. And we've been in Florida for about 15 years now. And we like it down here, but we still miss Houston. And, Houston has some of the best sleep centers in the country. And actually they, the medical field there is one that people come from all over the world to come to Houston for care. So, I miss that part of Houston, but there's also good healthcare in Florida. And I think I work for one of the best healthcare systems in Florida. And I'm honored to be doing that as well. So you really wanted me to talk about, the role of the sleep technologist, where it is today, where it's going tomorrow. And a lot of the things that's happening with sleep right now is based on things that's happening in healthcare overall. And, it's a real focus on outcomes-based medicine now rather than performance-based. That's what it used to be. And really, the focus is improving performance. And actually CMS is really driving this because, they don't want performance-based medicine. They want to see outcomes-based. They want to see patients get better faster. So, that goes along with sleep because we know how important sleep is and how it impacts almost everything in our lives. And people kind of take sleep for granted. So I do quite a few talks in the hospital system and in the community about sleep hygiene and the importance of good sleep. And I think a lot of people are recognizing that across the country now, that sleep is very important. And that's why we're seeing the technology change so much. There are so many gadgets out there now, and people really believe that they can track their sleep by just by all of the things that are available to them, including the Apple Watch and all the other things that are out there. So it's important for us to really think about how these things have impacted sleep medicine. The healthcare organizations in general are looking at reducing costs and creating efficiencies and making healthcare more accessible to patients. And we've seen that come in sleep as well with home sleep testing. That's a big part of patient accessibility. And I think that when home sleep testing started, most of the people, even like me, thought that that was a big threat to sleep. And it has been somewhat of a threat because, you know, some sleep centers have closed because of the reimbursements related to home sleep testing, but it also presents some opportunities. So I think we have to really kind of grasp the technology that's out there and try to use it to our benefit rather than thinking that it's a threat. Organizations are being driven to improve in other areas, but as you improve, the bar just keeps rising, and we see that as we do better, somebody else out there is doing better than us. So we have to always try to do our part to make sure that we're really focused on trying to do better. But I think during this time that we've seen these changes in healthcare, we've also seen changes with technologists losing jobs or having reduced work hours, job freezes, hiring freezes, especially during COVID, salary cuts, and actually not seeing pay increases, and paid time off having to use, especially in the hospital system, they have to use what's called low census when they take off because, you know, if we don't have patients, we don't have the techs working. So they do have the option of using low census. And then there's elevated levels of frustration as a result of this. People are not feeling at ease about their jobs. There's low morale in healthcare in general because, you know, people are working harder for less money. So that kind of presents a challenge.
Marietta, you've got a fairly big staff. You know, I've met quite a few of them, you know, in our visits to your lab. Knowing that you've got these changes and, you know, how do you begin to coach them up? Because, you know, no question, they're going to feel threatened by new technology, the very things you're talking about. How do you coach them up so that they can begin to see, you know, some of the roles that are emerging and how those things might benefit them?
Yeah. I think one of the things we really focused on from the very beginning when the BRPT came out with the CCSH credential is making sure our technologists kind of embrace that. And I have 26 techs right now, and almost all of them hold the CCSH credential. Probably it's only around 6 of them that don't have it. So I believe that our organization has more CCSH people here than anywhere else. The other thing that we did is create some jobs that the clinical sleep health educator could do. One of them is I created Janice East when she was here, and we created a job called the coordinator of clinical sleep health. And that person is really charged with doing a lot of things that's related to patient education. So we have a perioperative screening program. He's over that to make sure that patients that come in the hospital get screened for sleep apnea before their surgery. And then there's follow-up after that where he, along with some of the other staff, will send out notifications to the physicians about their patient's outcome. And it also goes in the medical record so that the physician, the anesthesiologist, can see if the patient has sleep apnea before they have surgery. So that has really been something where I've been able to promote 3 people up to clinical sleep educators as a result of that. So with them holding that credential, I think it gives them that opportunity to move from just being night techs to being more involved with patient education. I think that's where it's going to end up eventually anyway. So it's preparing them for these changes that's ultimately going to occur in the sleep field.
Sure. You know, and I think there's 2 questions that I think of when it comes out of that is, for our listeners who are managers, how did you justify that? Because, I know that Robert and Jerry and I have talked to people over the years that sometimes is the first big hurdle. How do you create a position like that and justify it? And then the second question, and this one obviously is going to have a longer answer, is, how does someone prepare for that? Because, you're developing out these champions, these subject matter experts who are capable of, really being like a case manager in a sense.
Mm-hmm.
So
Yeah.
for our managers in the audience, how did you fight that fight? You're part of a big system. How did you create that role in such a dynamic system as Baycare?
Yeah, it is a big hospital system, and you do have to go through a lot of hurdles to get things done. But if you just have the right wording in the, we created a position, a brand new position, and we came up with a justification for the position. So it basically was a role where we first talked about how sleep disorders is transitioning in sleep medicine. And we had the sleep technologists already performing a lot of the clinical roles that is going to be needed over the next few years. And that's basically patient education, being on the floors to help the nurses to educate patients about sleep medicine. And actually, I do go to a hip and knee class and do classes there, go on the floor sometimes and talks to the nurses about sleep disorders. And we even develop a flyer on does my snoring patient have sleep apnea? So just doing things to make ourselves known in the hospital system, and what we can do as far as helping to prevent readmissions or decreasing the length of stay. Being there as a like a referral base for when the social workers are trying to get the patient out of the hospital, and the doctor says the patient needs a sleep study, either being willing to give them a home sleep test in the hospital, even though we're not going to get paid for it, or having that patient discharged straight to the sleep center. We're working with the hospital to make sure that they know that we're very important and we're doing our part to keep patients out of the hospital and to decrease that readmissions. So we wrote a justification for the position, saying it was an international credential that was associated with this role, and that there was a CCSH credential out there. And as sleep centers became more focused on clinical outcomes and reducing readmissions, this role was vital. So, we got it approved based on that. And then we wrote into that position some of the things that that person would be doing with patient care, which, eventually we got the position posted and was able to move one of our night techs actually into that position. And it was really ironic because we thought that, well, I guess I didn't think about when we wrote the position that they needed a degree of some type. And one of our night techs actually held that degree and he got the job. So I think it was a big win for the team for him to move into that position. And then we have 2 clinical sleep educators. They spend a lot of time calling patients with follow-ups for CPAP to make sure they're using their equipment. And not only the clinical educators, but our scoring team. They're calling patients every day, seeing do they have their CPAP machine. If not, helping those patients maneuver to get that machine. So they do it quite a bit.
Marietta.
Marietta, I know that your hospital system has a DME also, so you're essentially a comprehensive service to the patient. And kind of going back to the value-based care model, I don't know if you have done any of the data gathering, but what the health spend or the health procedures that were necessary for some patients prior to being diagnosed with sleep apnea and then treated with sleep apnea, and then what those same patients look like after treatment. Have you done any research like that sort of internally with your own patients there at Baycare, or is that something maybe that could be a part of data that you look at in the future?
We haven't really done anything like that, but it is a good idea to look at that to make sure that they know that this is having an impact on the patient population. We have looked at how many patients we identified with sleep apnea when they came into the hospital system before they got here, you know, before they had their surgeries. And we also have some data on, you know, what their stop bang scores look like before surgery and what they look like after they got on CPAP. So, but it's kind of hard to track patients because of the fact that most of our patients are direct referrals. So, you know, they don't see our physicians necessarily. They're coming from our primary care doctors and community doctors. So it makes it more difficult to be able to track what happened to these patients as far as their outcomes after we call them for 60 days after they have a sleep study. And after that, we don't really track them anymore. If they say they're doing okay. If they're not doing okay, we might still be helping them.
Marietta, you spoke just now, you talked about outcomes, and you know, it took me a long time to understand what that meant. Would you mind telling the listeners and the viewers a little bit about you know, performance-based versus the you know, outcomes-based practice that we need to be moving to? You kind of described a little bit about that, but what does that mean for us who don't understand what that means?
Well, the goal of the performance-based is where you're looking at, you know, how many procedures can I do? You know, looking at the volume versus looking at, are we really helping these patients? So we're looking at performance improvement, improving the patient experience, strengthening even physician relationships within the healthcare system, and then finding new approaches to financing healthcare, and utilizing any new technologies that's going to help us reduce costs. So we're doing a lot more for patients, things for patients that we're not getting reimbursed for, but it's a part of that whole realignment of getting the patient involved, making sure they're a part of their own healthcare and also the family involved. So it's an overall focus on wellness, well-being, getting that patient fixed before they get to a critical position. And then just making it easy for caregivers to provide the right care at the right time. And of course, rates reduction is a part of it. But really, you know, the outcomes is just to make sure that we get that patient where they need to be at the most economical costs, because we know that the reimbursements are going down, but we're doing a lot more for patients as far as their overall health. It's not just a focus on one disease, it's a focus on the overall health of that patient. So that they do have a less of they're not costing the whole healthcare system a lot of money, because we're not finding all the things that could cause more problems for them down the road. So, you know, I think people are really recognizing that sleep apnea untreated is causing a lot of problems that could prevent that patient from being in the hospital later on with some kind of pulmonary disease or a heart disease. So just trying to get them to see that sleep apnea impacts a lot of your health. And I think people are beginning to realize that.
When it comes to sleep apnea in general, I mean, you know, what's changed since all of us got into sleep are the number of options. You know, and some people tend to kind of gravitate toward the gold standard of CPAP. When your navigators or your specialists are working with the patient, what are all of the options that they might consider in managing a patient? Because we clearly have a lot more today than we've ever had. What sort of guidance do they have to work inside that space?
Well, you know,
we're running out of time. Let's have that answer for the next episode.
Okay.
Thank you so much for joining us, and everybody, we'll see you once again on the next one. Thanks again.
Thank you.